Hello, my name is Rita Rasuli. Welcome to Understanding ACEs and Toxic Stress. After this training, you'll be able to define ACEs, be able to recognize the risk factors of ACEs, as well as learn some protective factors that help to minimize the effects of ACEs. You'll be able to define toxic stress, know the risk factors of toxic stress, understand the impact of ACEs and toxic stress on the individual's physical and mental health in adulthood. You'll also learn the benefits of implementing screening and be able to provide resources to families to reduce the risk of ACEs. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur during childhood and teenage years. These traumatic experiences may put youth at risk for violence, chronic health problems, mental illness, and substance abuse, among other negative behaviors in adulthood. The original ACE study was conducted by the CDC and Kaiser Permanente between the years of 1995 and 1997. Over 17,000 HMO members from Southern California participated in a confidential study in which they were asked questions regarding their childhood experiences and their current health status and behaviors. Researchers were looking for an association between ACEs and health outcomes in adulthood. Survey questions covered 10 categories of traumatic experiences. For each experience the individual reported, 1 point would be added to the ACE score. Since the original study, research on ACEs has been at the forefront of healthcare services. In California, ACE screenings for children, adolescents, and adults have become more readily available, with more and more health practitioners, including Medi-Cal providers, becoming ACEs Aware certified. The categories covered in the study are physical, emotional, and sexual abuse, neglect, both physical and emotional, a family member with mental illness, incarcerated family member, mother who experienced domestic abuse, one or more family members with substance abuse, and divorce. The results of the original ACE study found that 1 in 8 adults reported having 4 or more ACEs. Researchers also found that having 4 or more ACEs are associated with a dramatic increase in most of the leading causes of death in the United States and globally. This groundbreaking research has led to decades of more extensive research on adverse childhood experiences. More recent studies have shown the number of people reporting ACEs to be higher. The original ACEs study found that nearly 2/3 of adults reported having at least one adverse childhood experience. In a survey conducted between 2011 and 2012, it was found that 34.8 million children in the United States were impacted by adverse childhood experiences. Recent studies show that almost half of the children in the United States have experienced at least one ACE. The Kaiser study also found that ACEs are not specific to one race or ethnic group. Participants of the original ACE study reported their race and/or ethnicity as white, African American or Black, Hispanic or Latino, Asian, Pacific Islander, or other groups. ACEs can affect anyone regardless of race. In later studies, surveys conducted across 25 states found that 61% of adults reported having experienced at least one ACE. In more recent studies, researchers found that the number of adults reported having experienced at least one ACE during childhood to be 1 in 6. These studies also found that women, American Indian, Alaskan Natives, and African Americans may be more likely to experience 4 or more ACEs. Let's take a look at how a person's ACE score can increase the risk of health problems in adulthood. Each of the ACEs studies conducted found that the more adverse childhood experiences that a young person has, the greater the risk of developing health problems later in life. Originally, it was found that 4 or more ACEs are associated with a dramatic increase in at least 7 of the 10 leading causes of death in the United States. Researchers found that a person who has at least 4 ACEs is twice as likely to develop and die of heart disease, cancer, or stroke. They are 11 times more likely to develop Alzheimer's and 30 times more likely to die by suicide. Globally, 4 or more ACEs are associated with a dramatic increase in 6 of the 10 leading causes of death. People who are reported to having a high ACE score have a much lower life expectancy than those with lower or no ACE scores. People with 6 or more ACEs have a life expectancy that is 19 years shorter than those with no ACEs. Those with high ACE scores are also more likely to practice risky behaviors such as sexual activity, smoking and vaping, and substance use. Young people who experience ACEs are 4 times more likely to initiate alcohol use and 5 times more likely to initiate illicit drug use before the age of 14. They are also 4 times more likely to experience early sexual activity and teen pregnancy. The impact of ACEs are found during very important developmental stages in a young person's life and well into adulthood. Babies who are exposed to ACEs may be at risk for growth and developmental delays and may fail to thrive. For school-age children, exposure to ACEs may lead to increased risk for viral infections, asthma, pneumonia, as well as difficulties with learning and behavior. Adolescents are at higher risk for somatic symptoms such as headache and abdominal pain, increased likelihood of engaging in high-risk behaviors, teen pregnancy and paternity, sexually transmitted infections, substance use, and mental health disorders. As adults, ACEs can lead to increased risk for diabetes, COPD, heart disease, stroke, cancer, anxiety, depression, chronic pain, substance use, and PTSD. Young people with higher ACE scores are more likely to experience difficulties in academic performance. Students with ACEs are known to be up to 4 times more likely to experience developmental delays, learning challenges, behavioral problems, difficulty completing assignments, higher absenteeism in high school, and repeating a grade. They are less likely to graduate from high school. ACEs are associated with a dramatic increase in substance use. Opioid initiation, injection drug use, and the likelihood of experiencing overdose are all associated with ACEs. Students reporting 5 or more ACEs are 15 times more likely to report opioid misuse than those that report 0 ACEs. Experiencing any trauma before the age of 18 is associated with an increased risk of substance use. Adults experiencing 4 or more ACEs are 3 times more likely to report opioid misuse. In adulthood, ACEs are linked to chronic health problems such as diabetes, pulmonary disease, heart disease, cancer, depressive disorder, substance use disorder, and socioeconomic challenges. Having at least 1 ACE is associated with an increased risk for suicide. Adults having 4 or more ACEs are 30 times more likely to attempt suicide. Adverse childhood experiences and prolonged exposure to poverty, racism, and discrimination, shelter and food insecurity, along with other unstable environments, are risk factors for toxic stress and are associated with health risks later in adulthood. The most common ACEs reported are parental separation and economic hardship, regardless of race and ethnicity. Stress is not something that can be avoided. As a matter of fact, some stress is necessary for development. Let's take a look at 3 types of stress. Toxic stress can be detrimental to brain development, mental, and physical health. A young person who is exposed to constant stress without the protection of a nurturing, trusted adult and a safe and stable environment can lead to toxic stress response. Toxic stress develops when the brain is consistently activating the stress response because of prolonged or excessive exposure to stress. When faced with a stressful incident, a person may experience physiological changes such as rapid heartbeat and sweat. Stress reactions are commonly known as the fight or flight response. When the brain is busy reacting to constant and/or prolonged periods of stress, it cannot develop properly. As a person is faced with a stressful event, cortisol is released in the brain. While cortisol can help in stress response, high or constant levels of cortisol are found to have a negative impact on neurological as well as other biological functions. Although some adverse experiences cannot be avoided, children who have protective factors are able to build resiliency and are less likely to develop many of the health challenges that we have just discussed. These protective factors are safe, stable, and nurturing relationships, a consistent family life, positive friendships, caring adults who serve as role models and mentors, caregivers who have steady employment, caregivers who help children work through problems, families that engage in positive and fun activities together, families that can meet the basic needs of food and shelter, and live in an environment that has high-quality schools and low or no incidences of violence. Preventing ACEs can dramatically help children and adults to thrive. The risk of conditions such as depression, cancer, and diabetes, as well as risky behaviors such as drinking and smoking, can be dramatically reduced by preventing ACEs. Up to 21 million cases of depression and up to 1.9 million cases of heart disease can be avoided by preventing ACEs. Preventing ACEs can also dramatically improve education as well as employment potential and can help stop ACEs from being passed down from one generation to the next. ACEs prevention is a community effort. Providing safe, stable, and nurturing environments for children will have a positive impact on their physical and mental outcomes. Reducing stigma and seeking help for mental health and substance misuse for adults can reduce the number of ACEs children experience. The CDC recommends that communities should improve school environments to lessen the impact of ACEs and to prevent further trauma. Provide education to healthcare providers to recognize ACEs risk in children and to assess ACEs history in adults. Increase access to economic and support programs for families facing hardship. In an effort to improve health in California, the California Department of Healthcare Services, or DHCS, and the Office of the Surgeon General in California are leading ACEs Aware. This is the first in the nation to increase ACEs screening and treat toxic stress. ACEs Aware has significantly increased the number of Medi-Cal providers trained in ACEs screening. This will significantly increase the number of individuals, both young and adult, who will be screened for ACEs. The California Healthy Kids Resource Center is a resource that is available to educators across California. This lending library is available for educators to utilize within the classroom. Among other subject areas that promote health literacy, there are several curricula to choose from in social-emotional health. Now it's time to test your knowledge. Please type in the URL you see on your screen, or using your phone or tablet, scan the QR code. This will take you to a Google form for assessment. Once you have successfully completed the assessment, you will receive a certificate of completion in the email you provide. Thank you for watching this training video on ACEs and toxic stress prevention.